Hey everyone, it's Bypass Blake here, and on today's episode we're going to be breaking down the pros and cons or risk versus benefit of weight loss surgery so you can be well informed and consider it as an option to help you lose weight. So stick around. I will be breaking down the pros and cons of all weight loss surgeries in general. Specifics on the surgery, such as the gastric bypass, the sleeve, the band, the duodenal switch, I will have in another video. I will link that in the description down below. Check out this video first to make sure the benefits outweigh the risk for you. Alright, so like anything in life, you have to compare risk versus benefits. Luckily, with weight loss surgery, the benefits way outweigh the minimal risk. It's no surprise that more obese or overweight you are, that you encounter more health problems. When you're overweight, your body is always under constant physical stress and inflammation on everything, such as your joints, your heart, your blood vessels, your lungs, your kidneys, your liver, and almost every system in your body from dealing with all that extra weight 24 hours a day, 7 days a week. Losing weight and getting to a healthy weight range will significantly reduce current health problems or keep you from developing health problems in the future. That brings us to the first major benefit, which is weight loss surgery will improve your overall health. This isn't specific just to physical health. It also is shown to improve your mental health and improve fertility in women. Losing weight from weight loss surgery is shown to reduce complications from diabetes, blood pressure, and sleep apnea, just to name a few where major weight was the cause. It also reduces your chances of having a stroke, a heart attack, cancer, and an overall reduction in death related to medical problems. Don't believe me? I'm a numbers guy, because numbers do not lie. And I found a mind-blowing study from the New England Journal of Medicine, cited in the description below, that really showcases the long-term benefits of having weight loss surgery. This study followed around 9,900 patients who had undergone gastric bypass surgery and 9,600 patients who were severely obese, meaning severely overweight, that didn't have weight loss surgery from the years 1984 to 2002, with an average age of all participants around 40 years old. I know that was a while ago, and there have been slight improvements in the surgery since then, so today's statistics should be even better. But what they found was the people that had gastric bypass had an overall reduction in mortality, meaning an overall reduction in death of 40% as compared to the people that didn't have gastric bypass. In the same study, they also saw the people that had the gastric bypass a reduction of 56% for coronary artery disease, which is heart disease, a 92% reduction in diabetes, and a 60% reduction in cancer. Wow. If that doesn't sell you on the benefits of weight loss surgery and losing weight for your overall health, I don't know what will. Now, I'm going to note here that the reduction in diabetes is specific to the gastric bypass and duodenal switch, and not for the sleeve or the band, but I'll discuss that in detail in other videos. Now, on to the complications. Anything in life is going to have risk. Luckily, the risk or complications for weight loss surgery are low and manageable, and the benefits I listed are way more worth a small risk. There are two types of risk: short-term risk from the actual surgery and long-term from the type of procedure. Short-term risk during and shortly following surgery show an overall death risk of around 1% or less. The band is 0.1%, sleeve is 0.4%, bypass 0.5%, and switch is 1.1%. And the overall major complication is only 3 to 4%, and that includes blood clots, ulcers, and leaking around the surgery site, which can all be fixed. More common short-term complications are wound infections, breathing problems, which is usually after anesthesia, and minor bleeding, which is from the laparoscopic cuts from surgery. Keep in mind that any surgery has risk, and that weight loss surgery, when done laparoscopically in an experienced surgeon, are very low when compared to even routine non-weight loss surgeries that other people have done. Long-term risks vary and depend on the type of surgery, but some are bowel obstruction, gallstones, dumping syndrome, which is in the bypass only, hernias, low blood sugar, malnutrition, which is mostly in your switch patients, ulcers, vomiting, and acid reflux, which the reflux is very common in the sleeve and not so common in the bypass. Most of these long-term risks are fixed with medication or dietary changes, such as taking fiber or Miralax for bowel obstruction, medicine for gallstones that you take just 6 months post-surgery to prevent them, daily multivitamins for the malnutrition, not taking NSAIDs such as ibuprofen or Advil, which cause ulcers, Zofran for nausea or just not eating too fast or too much, and heartburn medication for people that develop acid reflux with the sleeve. I want to point out that complication rates vary depending on the type of surgery you end up going with. Each surgery is different and tailored for different people with different medical problems. In conclusion, like I said before, I'm a numbers guy. I'll take the odds of the benefits versus risk any day on weight loss surgery. You have to also factor in the risk of not having surgery and staying severely overweight, such as risk of dying from a heart attack, stroke, diabetes, or cancer. If you found this video informative and enjoyed it, then smash that like button, hit that subscribe button, comment, share, and check out my other videos on this channel. As always, thanks for watching.